I was diagnosed with Crohn's disease when I was 21 years old. I was sick for probably about a year and a half, and no one knew what was wrong with me.
I've been diagnosed with Crohn's since I was about 8 years old. In middle school and high school, I started realizing, yeah, this is pretty serious.
Colorectal problems are often really embarrassing for patients. It deals with your gut and your bowel function, and so I think it's really important to make patients and referring physicians comfortable and to treat them like they're your own family.
I had really bad abdominal pain, continued to lose weight, not really able to eat anything, so much pain, couldn't go to work. And I finally went to GI doctor at Caramount and got a diagnosis within like 2 weeks. I called Alex, my brother. He went through this at such a young age. He was really sick pretty much my entire childhood.
Junior year, that's when I needed my first surgery. That was a rough time. I had to miss parts of high school. The whole summer I was in the hospital. It was just a rough time.
I was really scared because I knew how serious Crohn's can be and how much of an effect it can have on someone's life. I finally reached out to Dr. Grucela, and she gave me my life back.
She was really suffering before surgery. She had nausea, inability to eat, obstructive symptoms, and weight loss of about 20 pounds.
Inside, I wanted to die. Waking up every day with such severe pain, joint pain. I had ulcers in my mouth. No one really knew what I was going through.
When you have Crohn's and you're suffering like this, it just takes over your life.
She was really upset and nervous. I tried to calm her down a little bit, saying that everything will be okay, you'll feel better.
I was kind of running out of options. I really had no other choice but to have surgery.
One of the more common locations that Crohn's disease affects is the terminal ileum, which is the end of the small intestine where it transitions into the colon. We came up with a treatment plan which included a robotic ileocolic resection for her. What we are able to do is remove that portion of the terminal ileum and the first portion of the colon, so that's called an ileocolic resection, and then join the two ends together. And we're able to do all of that on the inside so that the incision we need to make to remove the small bit of bowel is extremely small, and so that leads to less scarring, less pain, and faster recovery. After surgery, patients usually spend 1 or 2 nights in the hospital, which is amazing. They get to eat and drink right away. And patients who have this particular surgery, meaning a robotic ileocolic resection with an intracorporeal anastomosis, have even regained their bowel function within 12 to 24 hours after surgery.
I'm forever grateful for her because I was able to go back to work within 3 weeks. I had my surgery on a Monday, and then 2 weeks later, I was back at work.
She underwent a robotic ileocolic resection, did extremely well, and was able to get back to her work, life, and family and feel better.
It was in the fall semester. I was having a lot of stomach pains. I wasn't eating. I had a follow-up with my doctor, and I got a CAT scan. It showed that there was inflammation in my intestines. He immediately contacted Dr. Grucela, and that was when I needed surgery.
To have me have surgery on January 10th, and then Alex have surgery at the end of January, not even 4 weeks later, that's a lot.
And I can't even imagine having one child sick, but then another child on top of it. I just wanted to be able to, get him through surgery the way that I was able to his sister, and, have that expectation that we could do it minimally invasive. Alex, a few weeks later, underwent a robotic ileocolic resection for complex Crohn's disease, and he recovered extremely well.
After the surgery, I was up and running in about 2 days. It was a fast recovery.
I was really happy with their result, and also being able to keep this family healthy, and be able to get them and their mom through this extremely difficult period of time.
I changed my whole diet. I got a new medication, exercising more. It definitely put me on a better track.
Alex and Gabrielle are amazing examples of strong individuals who were able to go through surgery and recover and get back to their work and life.
I just hope that more people can become more aware of Crohn's and ulcerative colitis because it's becoming more common now and a lot of people have it. There's so many ways to treat it, and surgery is okay to have.
There's a lot of patients out there who are suffering from Crohn's, who need surgery, who are extremely afraid and hesitant. Not every Crohn's surgery needs to be a full, huge laparotomy incision, and that not every surgery needs to be open, and that we can do it minimally invasively, and patients can return back to work and life. My hope is that they can inspire other Crohn's patients and sort of allay their fears in having to have surgery for Crohn's disease.
People don't really understand it. They think it's just stomach pain, but it's not.
Thank you, Dr. Grucela, for everything. Without you, I don't know where I would be right now.
Dr. Grucela, thank you so much. You gave me my life back.
I'm Alexis Grucela, a board-certified colorectal surgeon and robotic surgeon with Caramount Medical.